Morning. Happy Sunday. Welcome to Dr. J's Prescription for Health. I am your host, Dr. Malea Jensen. This is Tucker, my co-host from heaven. So together we will answer your medical questions today and hopefully get a lot of things answered for you. Good morning, Carla and Jose. Appreciate you guys being here. Sandra. So if you have questions, we are live this morning on YouTube and Instagram. As a reminder, this is not medical advice. I am a family practice physician. You are likely a patient of somebody, but you're not my patient and I am not your doctor. So this is for information purposes only with a little bit of entertainment spliced in. So first question, good morning, Jeff and Chris and Stacy. Thank you for joining. So we will get started. Okay, first question coming in is in regards to blood pressure. I have high blood pressure and I'm on medications. What are your thoughts? Well, what are my thoughts about what? I mean, that's a good question. You have to ask yourself, why are you on a blood pressure medicine? What caused your blood pressure to rise in the first place? You know, the most common diagnosis that a doctor will give for your blood pressure is a diagnosis code of I-10, essential hypertension, meaning we don't know really what caused it, nor are we going to look, but here's your medication. So look at your diagnosis. I'm interested to see what diagnosis code that your doctor put for you and why. So blood pressure. One, I would ask you, have you been taking your blood pressure at home? Are you just taking your blood pressure in the office? And are you taking your blood pressure correctly? If you just run into the doctor's office from your car after traveling from your house, you're going to be stressed. And you come into the office, they get you up on the table, your feet are dangling, they likely crossed, and you're stressed. So how should you appropriately take your blood pressure? One, when you come into the doctor's office, you should go to the bathroom, relieve your bladder. Just simply having urine in your bladder can raise your blood pressure. I know, I bet you didn't know that. Two, you should be sitting down on a chair with your feet flat on the ground, not crossed. You should sit there for 20 minutes before your blood pressure is taken. You should not talk. And you should try to relax. So those are just some of the ways that you can get an accurate blood pressure. If you can't get an accurate blood pressure in the doctor's office, take some blood pressures at home with using these criteria. Now, you have to ask yourself, why is your blood pressure elevated if in fact it is? And what is elevated? I mean, is 130 over 85 elevated for you? Or the doctor? Did they look for reasons why your blood pressure is elevated or just say you got high blood pressure? Could it be? I'm just throwing this out there. Hi, Joe and Yuri. Thank you for joining. James. What is the likelihood of your blood pressure simply being a defense mechanism for you? What are the chances of your blood pressure being elevated as a defense to protect you? You see, if we have decreased blood flow going to our vital organs, that means they're not going to get nutrients, they're not going to get oxygen, and they're not going to get oxygen and nutrients, iron, hemoglobin. They're not going to get vital nutrients if there's not adequate blood flow. So could it be a defense mechanism that you have terrible blood flow to organs and your blood pressure is going up as in order to defend your body from dying, the vital organs from dying, your brain, your heart, your lung? Blood pressure simply go up in order to protect you. It's a great question, right? And then, is there something you're doing that is raising your blood pressure, causing a chronic disease? Because really a blood pressure is a symptom. It's not really a disease. Diabetes It's a symptom of something else. Elevated blood sugar, but why is the blood sugar elevated? Carbohydrate toxicity, why are you eating the carbohydrates? So what is the most common cause of high blood pressure? High insulin. How do you get high insulin? High blood sugar. How do you get high blood sugar? High carbohydrate diet. You have a toxicity of carbohydrates leading to elevated blood sugar. Your body can't use them. Your body's becoming resistant. If you had a ton of muscle, that would help use some of the blood glucose, but maybe you don't, and you can't use it. You have low muscle mass. You continue to eat carbohydrates. You continue to eat carbohydrates all day long, keeping your insulin level elevated all day long, which raises your blood pressure. How? By retaining salt and water. So they'll tell you the doctor will tell you simply to stop eating table salt. Okay, I got you on that one. But what about the insulin level? Oh, they didn't mention anything about that. Why not? Maybe they didn't know. All right, so that's a good question. It's very important that you take your blood pressure correctly. Again, as a review, empty your bladder. Sit down, feet flat on the floor. Do not cross your legs. Sit for 20 or 30 minutes before you take your blood pressure. No talking. Don't talk to the nurse. Don't talk to yourself. No talking. That is the appropriate way to check your blood pressure. Oh, here's another good one. Should I get a DEXA scan? Well, I guess you have to ask yourself, why are you wanting a DEXA scan? I know I know I like to answer a question with a question, but I need you to not just be told what to do. I need you to think. Why is it that you are getting a bone density scan? Is it to determine your bone density or something else? Why are you getting it? Have you had a fracture? Are you older? Is that simply because your age? Is it simply because you're Medicare? And so your doctor is going to order it? Because remember, any diagnostic test pays for anybody ordering it. A diagnostic test will give a diagnosis. A diagnosis will lead to you being a patient. And since you're a patient, it will lead to a treatment. And usually the treatment is a medication. So before jumping into doing any diagnostic tests, ask yourself, will the answer to what I get as a result change anything that I'm doing? If I tell you you have low bone density, will it change your diet? Will it change your activity level? Will it change anything in your lifestyle? If not, why get it? Why waste the money? Oh, you just want to know? Then get it. If you just want to know where your bone density stands, get a bone density scan. Is getting a bone density scan going to equal whether or not you have a fracture in the future? Bone density is a measure of bone density, not bone strength. It does not measure bone strength. Yeah, but I want to know if I need to take more calcium. Taking calcium does not make strong bones. You see, your bones are 50% protein, and what you should be looking at is what is your protein intake? If your protein intake is low, if you have low bone density, are you going to increase your protein intake? No, not particularly. Then why get a bone density scan? If you simply want to take medicine, get a bone density scan. See, I don't know how to answer your question. I'm just trying to give you thought-provoking questions right back at you, knowing why you're going to order a diagnostic test and what you're going to do with the results. Hopefully you make sense, that you can make sense of that. Question is, does Adderall cause low bone density? That's a great question. I don't know about a correlation between that, But what I can say, and I'm just extrapolating, I'm just using logic, Adderall is something that will definitely stimulate your body. So it's going to increase sympathetic tone. So it's going to increase fight or flight, which is going to increase stress and cortisol and blood sugar. And could it lead to low bone density? In a roundabout way. But like Dave is saying right now, lifting weights is one of the ways that you can increase bone strength, bone density. Every time that you lift weights, you contract your muscle. So every time when you contract, your muscle is actually tugging on the bone. So wherever a muscle is attached to the bone, you are going to strengthen the bone. Weight-bearing exercises are better than swimming. Swimming, you're buoyant, especially if you have fat. Fat floats. So you're not using any type of, you're not increasing your bone density. In fact, if you went up out in space, your bone density could come back. When you come back, it could be lower. So, body weight exercises are better than nothing, but lifting weights and increasing contraction of the muscles on the bones will strengthen them. Dave also mentions vitamin K2. I would agree. K2 helps to support drawing calcium out of the bloodstream where it's maybe at, and then putting it back into our bones and teeth. Vitamin K2 is very important. And that's one of the reasons that people who are on statins, it lowers their bone density because it blocks the production of vitamin K. Cargo says, I've stopped eating all grains. I hope it's going to be okay. I think you're going to be okay, but why don't you let us know in 6 months? Hi, Doris. All right. That was a good question. I like bone density questions. I think the key is just realizing that there's a difference between bone density and bone strength. And just because you have high bone density, it doesn't mean that you're going to have strong bones. I mean, 50%, besides protein, 50%, the other 50% is minerals and collagen and all of these, in cartilage and building blocks that makes bone. And a lot of us, especially as we get older, we don't eat accordingly. That's going to help us build use the building blocks to build bone strength. And so our bones naturally diminish. People will tell me all day long, well, it's hereditary. Well, then it's hereditarily that you ate bad foods, didn't eat protein, didn't do any weight-bearing exercises and resistance training. So children learn what they live. So it sounds like you live just like your parents. Good. I'm just reading your questions and your comments here. Most of you are just commenting. So if you have a question, put a question in there so I can tell that you got some things going on. Sounds okay. Calcium scoring. I get it. You're trying to put these things together, especially with Dave's comment on the vitamin K2. Should you be taking vitamin K2 if you have an elevated calcium score? Okay, I honestly, I don't know how to answer this. Mechanistically, vitamin K2 does help to bring or to draw out calcium out of the bloodstream and put it back into our bones and teeth. Get it? Should you take a vitamin K2 supplement? I think you need to do what's best for you. Do I recommend taking supplements in general? No. I would rather you eat saturated fat and cholesterol to help make your own natural production of vitamin K2. I want you to exercise. I want you to do resistance training. I want you to do weight-bearing exercises. We'll see you, Dave. Gotta go, Iron Lady. Love your steam. Love your stream. Thank you, Lifter Dave. I appreciate you being here. Good morning, Alonzo. You guys, when it comes to supplements, I truly believe a supplement is a diet that does not need to be supplemented. Processed foods, seed oils, sugars is not a diet that is going to help you longevity-wise. It won't help your cells be any healthier or stronger. Simply taking a supplement is a Band-Aid, I believe, for a poor diet. If you are eating a nutrient-dense diet that is high in fat, moderate protein, and low in carb, I don't think you need supplements. And so I guess I would proceed at your, just proceed and do what is best for you. Wendy says, should I exercise if I have arthritis? Yes, you should. Would it help or make it worse? And then what is best to eat? Well, what is best to eat is a nutrient-dense diet that is high in fats, moderate protein, and low in carbs. Arthritis means inflammation. Itis means inflammation of the joint. So you have inflammation of your joints because of what you're doing to your joints and what you're feeding it. So the things that you're eating is inflammatory. So if you keep eating what you're eating and don't exercise, you're going to get more itis of the joints, inflammation of the joints. So what is best to eat? High fat, moderate protein, and low carbs. Plants, in my belief, are inflammatory. All plants are inflammatory. Okay? I eat the least inflammatory foods, which is meat, butter, and eggs. Rick says, eat natto, which is a fermented soy, sauerkraut, or other K2 carrying foods. Okay? So Rick is giving his advice. Graybeard says, do you think creatine is good? Oh my goodness. Z, you have a great day. Got to run, Doc. Appreciate you sharing your knowledge. You're very welcome. Thanks for stopping. Do I think creatine is good? Of course I think creatine is good. I think creatine that comes from meat is very good. This is a question that comes up often for people who take... Oh, Lucy, you make me giggle. I think where doctors maybe don't have an understanding is that they think, most conventional doctors think that creatine is bad for your kidneys. And if you take creatine, you're going to destroy your kidneys. Now, maybe we're mixing up creatine with creatinine. Totally different. Although creatine is degraded to creatinine. Can we measure creatinine in our blood? Yes, we can. The BUN and creatinine give us an indication of our kidney function. But if we put all of our chips into just looking at the creatinine, then we might be fooled and we might be told that our kidneys are not functioning. We also need to look at a cystatin C. We also need to look at our eGFR, our estimated glomerular filtration rate. Looking at everything, but simply taking a creatinine level and telling you that the creatine that you're ingesting is causing your kidneys to fail is not true. That is a lie. But what I think you're asking, Graybeard, is should I be taking creatine supplement? Well, I take a supplement in the form of red meat. My red meat supplies enough creatine to get me by, which is, how much do we really need? I would say Do you need between 2 and 5 milligrams or 5 grams per day? Can our body make that? It can, as long as we have enough methionine, glycine, and arginine. So if you don't have enough of those amino acids, methionine, glycine, arginine, you cannot have enough or make creatine. So should you take creatine? Possibly. If you're a vegetarian or vegan and you're not getting enough protein, maybe that would be best to take a creatine supplement. There are lots of creatine articles out there, the good, the bad. I mean, but if you're worried about your kidneys, now, again, one caveat, if you already have kidney disease, would I be taking creatine? No. If your GFR is less than 60, I don't think I would probably take creatine. Would I stop? Because of the concentration. And I don't know what else is in there. What fillers, what chemicals, what other stuff is in there. Now, if I was not eating animal meats, I would consider taking creatine. But again, if you're asking me, is there a right or wrong answer? I can't, with good faith, tell you that there's a right or wrong answer. You're going to have people like Dr. Gabrielle Lyons, Lyon, Lyons. She's going to speak highly of creatine and creatine supplements, okay? Because she's the muscle is longevity queen. Muscle is the organ of longevity. I'm not going to disagree. She's I'm guessing, now please don't quote me on this, but from what I've seen, she would be highly in favor of taking creatine supplement. If you listen to the likes of someone like Ben Bickman, he will also give you pros and cons and many, many, many pros of why to take creatine supplement. Again, I think you need to read everything and make a choice for you. Do I take it? I have in the past, okay? Rick says he takes creatine twice a day. It's recommended in 5 grams in 2 different doses. That's fine. I think maybe 10 grams might be overkill. I don't think that you need that much, but again, that is up to you, okay? So good question. You know, I guess I'm gonna let my body see what it can do, make its own creatine in the kidneys and liver, and call that good. Lucy says, I do hear a lot about creatine and its cognitive benefit, 15 grams of creatine per day. I mean, there's no doubting this, Lucy. There's going to be studies coming out over and over and over again. I think it's fine to read these studies. I think it's fine to take into consideration all of the things. But if we're thinking that we can just simply take creatine and we're going to avoid cognitive decline, I think we need to take into consideration other things. Our brain needs fat. Our brain needs fat and cholesterol. So if we're taking something like a statin, which decreases fat and cholesterol in our bloodstream, so we're going to try to make up for that by taking creatine. It's kind of, I go back and forth with all these things. If you make a decision one way to lower something that your body absolutely needs, and then you're going to try to make up for the brain function by taking something like creatine, I don't know. I guess, again, you have to make right what you think. Conlon says, do you have any advice for a new OMS 1? So first year student, I'm 6 weeks in and we're starting our anatomy and OMM is in full swing. What do you mean advice? Keep going. Good luck. Have fun. Don't stress. Go for it. I'm not sure. What do you want me to give you advice on? It was a lot of years ago. I went to medical school. Are you, Conlon, are you in Canada? Are you in Canada and you are getting your osteopathic manipulative science degree? Or are you going to medical school and are going to be an osteopathic physician? Bok Choi says, yeah, it's all about bullshit. Love people are sheeps. I don't know was that a question? I'm not sure. Lucy says, I read Dr. Lyon's book. We all have to do our research. Yeah, Lucy, it's just what I like to do. And I don't follow, I follow Dr. Lyon's, but I will come across one of her posts every so often. She's not like somebody who's on my radar all the time listening to, because again, she's selling a lot of stuff. You're not reading correctly what I wrote. I'm sorry, Bok Choy, I didn't understand. But Dr. Lyons has a lot to sell. She sells classes, she sells books, she sells blah, blah, blah. I'm just here to give information, something that I might have read. I might bring it up to you. I might even ask, what are you guys' thoughts on a certain thing? What are your guys' thoughts on creatine? So Lucy says, hey, it's great for our brain. There's been studies done upwards to 15 grams a day. I don't think that we could eat that much creatine from our meats. I think that would be impossible. I don't even think a bodybuilder could actually get in that much creatine. But again, maybe they can. So supplementing, if that's what we need to do to keep cognitively intact, I would say there are other things that are probably causing cognitive dysfunction more so than your need to take creatine. In other words, are you eating sugar and processed foods and seed oils? If you're consuming those things, I would suggest that you stop and, put creatine on the back burner. Yes, people are always looking for shortcuts, myself included. I started to ask myself, am I looking for a shortcut? Am I getting all the nutrients I need with my current diet? That's good. You're using inflection, your reflection. You're trying to say, hey, what am I really thinking here? Am I trying to get the easy way out? Am I trying to fake myself out? Jean says, how do we stop taking high cholesterol medications? Would it be unhealthy to just stop taking it? I don't know what cholesterol medication you're on, but no, there's no reason that you couldn't just stop it. Conlon says, no, I'm in the US, but I am Canadian. I was just wondering if you had general advice. It's such a struggle to keep the perspective of how this will help me in rotations and residency. Conlon, the things that I am telling you right now, I did not learn in medical school or residency. I really had no notions. In fact, I'm going to be honest, we didn't have internet when I was going to school. And when I got into residency, then computers were starting to come into vogue. But again, I didn't have the luxuries that you have today, Conlon. I wish I did, but there wasn't YouTubes and there weren't getting advice from the doctors. It was only who was teaching us, and they taught you, or they teach you what they want you to know and to move forward. There's no spurring of your brain. No school has ever really done that. It isn't until I got out that I started using my brain. Before, I was just been fed stuff, information to regurgitate. You regurgitate it for a test or your boards or whatnot. And so what is the information I'm giving you today going to help you in your medical school? No, they want you to regurgitate what they tell you, and a lot of it is, I think, Conlon, it is indoctrination. I did not know that at the time, but I know it now. And there was a reason to be